new study finds most heart patients want a more active role in decisions about their health care. It's part of a trend that could affect the quality and cost of all medical treatment nationwide. Dr. Harlan Krumholz is one of the researchers behind the study, and he is a professor of cardiology at the Yale School of Medicine. Good morning.
Good morning.
Doctor, I have to tell you, when I first saw this study, I thought, well, of course. I mean, if you're having heart surgery, wouldn't you want to be involved? I'm surprised that this is something different than what happened in the past.
Well, I think there's a revolution coming. I mean, in the past, patients were expected to be obedient and compliant. Those who sought information and asked questions were the exceptions, sometimes with an eye roll. Doctors were put on a pedestal, and patients were often intimidated to question authority. In the future, I think you're going to see something different, and this is, I think, the beginning of seeing patients who want to be informed and engaged. It's a difference.
And doctors want it. Do you believe doctors want to be questioned? Doctor?
Well, look.
If I come in and I have 50 million questions, at what point do you say, okay, enough already?
Well, it's hard the way we're currently configuring care, where there's 10 to 15 minutes and things are rushed.
Yes.
And we have to find ways, and we have to get tools where we can sit down with people. And it's our responsibility to say things clearly and to help you understand and to create an environment where that works. Right now, it doesn't work well. And it can be a burden on the healthcare system.
And if you do it, there's no doubt that it will improve the quality of health care.
Well, I think by definition, you know, providing care that's aligned with your preferences, values, and goals, understanding you, making sure you understand the options and the trade-offs, that's got to be the highest quality care, and that's what we have to be able to accomplish.
I would assume this has something to do with the internet and access to information today.
Yeah, there's no question about it. The idea that patients now have access to many sources of reliable information and some unreliable information, but the democratization of information, the spreading of it, the ability for people to get the facts and to seek it from different sources is a really important change.
And you encourage us to be empowered patients.
Yeah, I think
your
this is
phrase.
important.
Yeah.
And I think for people listening, the idea is you may not have a medical degree, but you're an expert in how you feel. You can understand. You can be brave and ask questions. Doctors, it's our responsibility to make things understandable. I tell people, bring someone with you. Let them listen. Let them give you support. And you can find doctors who support your approach.
Do you expect people will continue to do this, that they will be, that this will have a real impact on the doctors so that they will understand that they need to make time for it?
Yeah, I think in the end, doctors are going to find that this increases their satisfaction. There's nothing better than sitting down with an informed and engaged patient, working together as partners, and trying to make the best decision together. Not one person dictating to the other, but doing it together.
And will it affect the cost, up, down?
Yeah, my hunch is that there are a lot of tests and procedures that are being done that people wouldn't choose if they knew all the facts. If we actually talked about things clearly and they knew what the size of the benefit was and what they had to go through to get it, I think in the end this actually could lower costs. It's not the principal reason to do it, but I think it could be a benefit.
All right, Dr. Krumholz. Always good to see you.
Thank you
for coming in.